Today, let's talk about mandibular advancement devices, also known as protrusive night guards, which are used to treat snoring and sleep apnea. I'll be fabricating this type of appliance for only the second time in my life. If you're interested in the full workflow, I already have a more detailed video on my blog where I show the step by step manufacturing process. But first, let's understand why snoring happens in the first place. Snoring is not just a sound, it's the vibration of the soft tissues in the upper airway. When a person falls asleep, several things happen. The muscles relax, including the tongue, the soft palate, and the pharyngeal walls. As a result, the airway narrows, and the airflow becomes turbulent rather than smooth. The key cause here is a partial obstruction of the airway. Now, what role do the lower jaw and the tongue play in this? It's very important to understand that the tongue is anatomically connected to the lower jaw. When the mandible moves backward during sleep, a position known as retrusion, the tongue follows and shifts backward as well, partially collapsing into the airway. This further narrows the airway and increases the vibration of the tissues. So, how do mandibular advancement devices work? Their mechanism is actually quite simple and mechanical. They gently move the lower jaw forward. This is called protrusion. When this happens, several important changes occur. The tongue moves forward along with the jaw and no longer blocks the airway. The airway itself becomes wider, especially in the oropharyngeal region. Airflow becomes more stable and less turbulent. And as a result, the soft tissues vibrate much less, which means snoring is reduced or can even disappear completely. There's also an important point to mention here. Snoring is often considered a milder form of obstructive sleep apnea. In sleep apnea, the airway can become completely blocked, leading to pauses in breathing. Mandibular advancement devices can be effective in mild to moderate cases. However, the results are not the same for everyone. The effectiveness depends on several factors, including the patient's anatomy, such as tongue size and jaw structure, the degree of mandibular retrusion, body weight, and overall muscle tone. If the main issue is not related to jaw position, but rather to factors like an enlarged soft palate or nasal breathing problems, the device may be less effective.